All right, welcome everyone. It's 2 o'clock. We will get started. We know that some people are still probably just joining us and just getting settled in. So we have a few introductions to do, and then we will be jumping right into it. So welcome to our session today on searching for Indigenous health information. I'm Orvie Dingwall, and I am a librarian. And Gail.
Oh, I'm Gail Matheson, and I'm a librarian with MyNet as well.
That's great. So I'm just going to share my screen, and Gail, you'll just let me, oh, there it should be displaying. Great. Yeah, so we're here for almost an hour today, and I'm going to kick us off by first, of course, acknowledging that the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and on the homeland of the Métis Nation. And I know that some of you are joining us from other locations other than University of Manitoba campuses. And so we just ask that you acknowledge the lands that you are on today. And if you're not aware of where you are and whose lands they are, then this is a great opportunity to look into that so that we can respect the treaties that were made on these territories. So today we're covering 6 things. We are hosting this event as part of Manitoba's Health Information and Knowledge Network. We know some of you are joining us from other places, and we certainly welcome you here today. So you'll get to learn about or have a refresh on our services. We're talking about the truth of Indigenous healthcare, Indigenous research methods, resources for health practitioners, and also consumer health resources. And if you've been to one of our sessions before, you know I always talk about critical appraisal, and so that will round us out for this afternoon session. So first up is, what is MyNet? It's Manitoba's Health Information and Knowledge Network, and it's provided out of the University of Manitoba Health Sciences Libraries to staff at Manitoba Health and fee-for-service physicians in Manitoba, and staff of participating regional health authorities. So those regional health authorities are the ones outside the city of Winnipeg, except for the city of Brandon. We offer service to health professionals in these regional health authorities. So we have 4 core services that we can do for anyone eligible for our services. And our librarians will conduct literature searches. So if you need to know information on certain topics or areas, we're happy to run those searches for you. We'll provide you the full text documents and send those your way. We have a current awareness service, so you can stay up to date on your favorite topics or what's being published by your favorite authors or in favorite journals. And we offer sessions like today, where education sessions, we can also come into your workplaces either virtually or in person and offer some really targeted education for what's going to be most relevant to your team. And also there is access to UpToDate as well. And all of this information and more is available on our website. So if you are eligible for MyNet and you want to know how to get a library account, they're free. You can complete the borrower registration form on our website. And this is also a great reminder that at the end of today, or after today's session, we will be circulating the slides that we've used today. So if you missed something or need the web link, by all means, that will be coming your way. And fill out that registration form, submit it to us, and then you have an account. And final introduction, Gail and I are the 2 librarians with MyNet, and we also have a library technician, Cheryl, who is often the first point of contact. So welcome from MyNet, and I'm going to turn it over to Gail. And maybe one last housekeeping thing. If anyone has questions as we're going along, please be sure to put them into the chat. Don't feel like you're interrupting or you have to wait until the end. Just pop them in the chat. And also feel free if something is, if you are doing a reaction, please feel free to use those emojis. I know some people love them, some people do not love them. That's okay, not mandatory. But if something is really resonating with you, it's helpful for us to know about that, and you can use those emojis. And now, Gail, over to you.
Okay, I'm just getting my screen. It was acting up a little bit, so bear with me for one moment. Orby, would you be able to do the slides for me? I think it'll be perfect. I don't know, wasn't covering stuff and I couldn't manage both at once. Okay, so like I said before, I am Gail Matheson. I am a librarian with MyNet. And I wanted to specifically say that my ancestors were settlers and my 4 sets of great-grandparents were English and Scottish. So today, my intention is to highlight and champion resources that were written and produced by Indigenous people and provide a few different techniques for searching for Indigenous health information. I will send out all of the copies of the slides to you next week. So you will have the links to the resources and you don't have to madly copy anything down. But I did want to say there are many, many, many more resources out there that on Indigenous health than what I'm sharing today. This is just scratching the surface. And it's really a brief introduction to searching for health information. And I'm going to have to go through things fairly quickly in order to keep up with time. So it's not, if I go through something quickly, it's not because I don't want to spend more time on it. It's just because there really is so much information to catch on. So one of the main things that has helped me with my searching is word mapping. So as I find resources, I gather terminology and phrases and I make notes so that when I'm ready to start searching, I can easily plug in different concepts into a search strategy. And one thing with Indigenous health information is that there are so many different languages and nations and geographic areas that word mapping is going to become really important, tracking all of those different terms as you go through. And it is not a one size fits all. So finding the best information, you're going to have to be really specific with the search terms that you're using. So I wanted to start with the truth of Indigenous healthcare. And I have to say, it took me a really long time to come up with the title for this slide, because I think the language that we choose to use is really important and it has an impact. And I thought of using the term history, but I don't believe we can think of any of this as history. I thought of the term legacy, but it didn't really seem to fit either. And then I realized a number of webinars and podcasts and information sessions that I've participated in and attended, they talk about not being able to have reconciliation before you have truth. So at the top here, I've started with a link to the Truth and Reconciliation Commission. You're looking for documents related to the calls to action, TRC reports, you can find them here. And they also have some health related information as well. The next 2 resources are about Indian hospitals. And I myself, I feel really embarrassed to admit this, but I didn't know anything about Indian hospitals before I saw Maureen Lux's book, Separate Beds. And I'm not sure how much other people know about or are aware of Indian hospitals. So I thought it was really important to start by highlighting these 2 books. So the National Collaborating Center for Indigenous Health, it also has a webinar that is freely available on their website that is related to separate beds that I would highly recommend. And it is a great kind of starting point. If you're registered as a Minet patron user, you can access both of these books through our document delivery. So you just have to make a request and then we can get those to you. So then on the next slide, I wanted to just mention a few other documents that have been published within the last few years on things like structural racism and cultural safety. And in particular, the survey on experiences of racism in Manitoba healthcare. And I think, again, using these resources to add terms and concepts to that word map and that are going to help support you finding those resources as you move forward and are searching for different things. So on the next slide, the next few slides are about a few different models, Indigenous perspectives on healthcare. So this first graphic is from the Métis Nation of Alberta, and it's looking at health priorities. And it actually comes from a webinar, Visioning the Future, which you can find on the National Collaborating Centre for Indigenous Health's website. And in the webinar, they mentioned that it's developed through community engagement in Alberta, and it's been validated for use by members of the Métis Nation Health Committee, and that the model itself is an infinity. So there's no starting point and there's no end point in the model. So as you look at the model, you can kind of start to pull out some of the terminology. So it's helpful for understanding other approaches to healthcare, but you can also look at the language being used. So things like intergenerational, on the land, traditional knowledge. And then if we move to the next slide, there is, I have another model from the First Nations Health Authority, and they have a wonderful description on their website to go along with it. And I'll just read a little bit of it. So the center circle represents individual human beings. Wellness starts with individuals taking responsibility for our own health and wellness, whether we're First Nations or not. The second circle illustrates the importance of mental health, emotional, spiritual, and physical facets of a healthy, well, and balanced life. It is critically important that there is balance between these aspects of wellness, and they are all nurtured together to create a holistic level of well-being in which all four areas are strong and healthy. The third circle represents an overarching values that support the up and uphold wellness, respect, wisdom, responsibility, and relationships. And they have more on their website. But I just wanted to use these diagrams to illustrate that there can be a number of ways of thinking, and you can start to pull the different terminology that's being used out of these different kinds of documents to support a search strategy. And if you are working with a particular community or nation, they may have their own models that you might want to use and look at that they've created. So the next thing that I wanted to talk about briefly is Indigenous research methods. And this is a huge area of study looking at the differences between Western methods and Indigenous research methods. And I know this slide is text heavy, but I really wanted to make sure that I didn't oversimplify it. So these points come directly from Indigenous research methods systematic review. So thinking about recognizes community as a unity of identity, builds on strengths and resources of the community, facilitates collaborative partnerships in all phases of research, integrates knowledge and action for mutual benefits of all partners, promotes a co-learning and empowering process that attends to all social inequalities, involves a cyclical and interactive process, addresses health from both positive and ecological perspectives, disseminates findings and knowledge gained to all partners. So when you're looking at different resources, you can keep in mind the differences between Western and Indigenous research methods and the impact that may have on the evidence or how the evidence is presented. So on the next slide, I have information about, I was talking about data governance. And I want to read a quote from Nathan Obed. He is the president of ITK, and this comes from a foreword that he wrote for the National Inuit Strategy on Research. So he says, researchers have enjoyed great privilege as they've passed through our communities and homeland, using public or academic funding to answer their own questions about our environment, wildlife. Many of these same researchers then ignore Inuit in creating their outcomes of their work for the advancement of their careers, their research institutions, or their environments. This type of exploitative relationship must end. And then I have a few other documents here that talk about data governance and Indigenous research ethics. And the graphic to the left is from the last document on this list, a First Nations data governance strategy. And I think the language in it is really powerful. So talking from an Indigenous perspective, so include all voices, with us, by us, for the children yet to come. So thinking about 7 generations into the future and 7 generations into the past. Nothing about us without us, and data sovereignty. So, and there is a huge difference between Western thought and Indigenous thought here, and the need to support data governance for Indigenous people. So data governance becomes really important when you start looking at statistical information. And then on the next slide, I have links to the First Nations Information Governance Center. So they have some really great information on OPAP, which is ownership, control, access, and possession of data. And I highly recommend watching the video that they have on their page that I have linked here. And there's also some information where it says surveys on the particular surveys that they have done. So First Nations Information Governance Center, they conduct different surveys using Indigenous research methods. You can go to their website, so the icon is linked there, and you can search for use some broad keyword searches, so diabetes, tuberculosis, to search for a few different things. Then, okay, so some other places that you can search for statistical information is through Statistics Canada. So on their website, they have some information that talks about the Indigenous Liaison program that they have. And they say that it's set up to serve as a bridge between Statistics Canada, First Nations, Métis, and Inuit communities and Indigenous organizations. I'm not sure when that committee was established. It seems like it might have been in 2021. So it's a really recent initiative. And I think that you have to keep this in mind when you're using all of the different data sets that Canada has, that it may not have been done through Indigenous consultations, some of the later information. Okay. Then looking at some of the challenges with statistical data, I have 2 documents here. So the Alberta First Nations Information Governance Center document, they identified 2 main challenges with statistical data. And it's not just Statistics Canada, that's generally across the board. So one thing to be aware of is consistency of language being used. So whether that's language from survey to survey or historically across time, language used to identify Indigenous peoples will often change. So Aboriginal versus First Nations versus Indigenous, and possibly maybe even using specific nations. But with that inconsistency of language, and sometimes lack of consideration, there might not have been an ability to choose at all. it makes it really difficult to compare data sets over time. And then they also talk about coverage and non-response. So these words come right from the report. Hesitant to participate in data collection activities due to historical systematic misuse of data and research. So having a lack of trust and having a significant impact on willingness to participate in research, and how non-response as a result can impact the data that's being collected. And then the second document there has some interesting information specifically related to census data in Canada that you can have a look at too. On the next slide, another place to look to help develop some of the terminology is some mapping tools. So when you're searching names of traditional lands or languages or nations, can be really helpful to your search. So in the first resource, First Nations Profiles Interactive Map, it is a Government of Canada site, and it identifies Indigenous communities in Canada. So by clicking on the green dots, it will give you things like contact information, websites, tribal council information, and census data. So if you want to know more about a specific community that you're serving, this can be a good resource to use. And it can be tricky to click on the right dots, I've noticed too, or so you're not alone with that. And I've had to really zoom in to even get it to work quite right. There you go. So then you get a box and you get some different information that you can keep clicking through and on. Yeah. And I think if you scroll down in that box, I think the census data link might be further off. No. It's possible that one maybe doesn't have the link too, because each one is different depending on the community. All right. So then the other map, that one is, so native land. On notes, sorry. Okay, so it looks at traditional territories throughout the world, and it will give you names of nations and languages spoken in a particular geographic area. And it can also be really wonderful just for looking at the land without all of the sector markings on it, without things like provincial boundaries. Yeah. So then you can copy some of those that terminology into your search strategies, and it can help you specify different groups. Okay, so then here, this is just kind of the beginning of a word map, but based on all of the different resources that I've highlighted, tried to bring out some of those different terms to the surface. And if you're doing a lot of searching, this is going to grow and become more complex. One thing that I didn't talk about yet is different terminology for Indigenous peoples. And the link here on the bottom, it's a guideline for when to use different terms. And one thing that I think is important to note is that in Canada, there are terms like Indian and Eskimo that are considered offensive and derogatory. If you're looking for information that's coming from the United States, those terms are still readily used. and even though they are offensive. So thinking about your word back and your search strategies, keeping those things in mind as well. And with library science, we also have controlled language that we use, subject headings, and you may see subject headings that use the term Indian in them. It isn't an acceptable term to be using. And, you know, I hope that there are changes coming soon with some of that language. But again, something to keep in mind that you will be seeing coming up in different catalog records. Okay, so Orvi.
So Gail, just a question on that, because you said,
Yeah.
you know, Indian, not an appropriate term to be using when we're speaking and interacting, but sounds like still like a necessary term that would need to be searched. So we shouldn't be concerned, like try to use the more correct phrases first. But if we're not finding what we're needing, and it's probably also if it's information from if we're looking into some history or into some past, some older documents, I guess would be a better way to put it, might need to go to that language, and we shouldn't shy away from that. That's just the reality of how currently you need to search for it. Is that a fair statement?
I think so, yeah. And this document too, it has some of the language in there. So if maybe you don't know to search Indian, then you can use this guideline to help you with identifying different terms as well too. But yeah.
And I think also, I mean, many places, or especially in Canada, guided by the calls in the for Truth and Reconciliation, there's been so many efforts to standardize the language in an appropriate way, so we don't have to search for those terms, but sometimes that still might be needed, right? Like, so lots of efforts being done.
Yes.
But still similar to.
And everything that I know is there really isn't a standard in terms of language, right? So, and that's what makes searching for Indigenous health information so tricky and challenging, because the differences between Aboriginal and Indigenous and Inuit and Métis and Anishinaabe, no one's really agreed on the best way to identify everybody when we're publishing information, at least not yet. And different countries are different. So I don't know if we're ever going to find that standard. Okay, so now looked at terminology in terms to be searching with. Now where to search. One of, when you're looking for health practitioner resources, so anything that's like research documents, systematic reviews, guidelines, traditionally we'll be looking in academic databases for that information. Academic databases will index content that's been published in certain publications. With Indigenous health information, many different organizations are publishing it and creating it, and not necessarily publishing things through those academic journals and sources. So a lot of really great resources are not being indexed in those academic databases. So yes, it's important to search them, but it's important to also be searching other places as well. And you're not going to be able to find everything within those academic databases. So I think I'm going to have to take control over Orvi. And I think I can do everything else now without my notes. Sorry. So let me get, okay, here.
Maybe just while Gail is getting that screen share up and running, just a reminder that if you're having some questions or you came in with a question and we haven't yet come to it, by all means, just pop your question into the chat, or if you have a comment as well, happy to see that. And then we'll be sure to do our best to answer your question in our next few minutes. Hopefully Gail's computer is complying with her.
It's looking at my whole, whenever I put PowerPoint to play, it covers up both of my screens and I can't even see the Zoom window. One other thing. No. Okay, I think that's okay. Let's try that. Right. There we go. Can you see the slides now?
Not yet, no.
Not yet. Oh.
There we go. There we go.
Okay. So then these are the 5 resources that I would suggest searching to start with. So iPortal, it's from the University of Saskatchewan. They manage it and update the database. Started in 2006. As of 2022, it had about 71,000 records in it. The unique thing about this database is they have included gray literature. So things like those reports and those association and organization documents, they've tried to include in here. So let's I'm assuming you can't see my screen, right?
Oh, it just popped up. And weirdly, we can now
Oh,
see.
did it come up?
Yep. We can see the PowerPoint behind it, and we can see it like a half. Oh, there we go.
Okay, good. Okay, so here's iPortal. It is an interdisciplinary database, so it's not just health information. So you can use fairly broad keywords to search for information in here. So I'll just pop in diabetes. And it's a fairly easy interface. The more keywords you can add in here, then you can narrow down. So we can throw in a specific nation in here as well. See if there's something for both. So you can layer in your keywords there to try and specify. I wouldn't, if you hit a paywall for anything, you're gonna make a request to MyNet for that document. So you're not gonna click open access at all. You can narrow resources down a little bit here on the right-hand side. They have different date ranges that you can choose. You can look at a specific subject if you want. I think they do only update it periodically. I haven't seen anything from 2023 in the database yet. So that's something to keep in mind. But it does bring in some different websites and some different places that the other resources won't have.
Gail, I note that there's about half of those are open access. And maybe just noting that that means they're freely available to anyone.
Right.
And the ones that are not open access, just a reminder to everybody that if you do have a MyNet library card, feel free to search all of these things. And if one of them does tell you, you're going to have to pay money to access this, or you don't have access, just grab the citation, email it to us, and we can provide you the full text from that.
Yeah, absolutely. So that's iPortal. I just really quick kind of intro to that. Then PubMed is the next one. So PubMed is a database that you can search for free. A lot of other databases fall behind a paywall and you can't access, so you can't search them. So that's one thing with PubMed that's great. So there's 35 million citations from Medline. So it is a biomedical subject area database. And there are some full text available and some that are behind paywalls again. So anything that's not free, you can make that request through MyNet. So you can start by doing a very simple keyword search. Again, diabetes. Because we're looking for Indigenous information, we're going to want to identify the population that we're looking for. So we're going to pull in some of those keywords. I'm just going to copy them right from my notes here. So again, I've only put a few in here, but as you start using your word map and as you start doing more research, this you're going to have many different terms that you could be including in here, and you can be really specific if you want to. So then you can narrow down to 3,000 results here. And then just to show you how different your results can be, depending on how specific your terms are, we'll just add in OG3 as another option. And it's added it, you can see right away it's added in more results. So now we're at 3,129. So the more terms you can add in here, the better for you. So the way PubMed is laid out, you have all of your article information down the middle, and then you have your limiters off to the left. So you can limit by systematic review. You could limit by date and say in the past 5 years. And now we're down to 56 results. I'm just going to reset my filters here. And I'm going to do another search. So this is one that I'm just going to copy it. But it's much more specific. So if we're looking at tuberculosis treatments and you have a list of specific drugs that you're interested in finding information for a particular population, we can add in tuberculosis. We can add in all of these different drug names because PubMed is meant to be searching for medical information. It's going to pull up various results based on that. Add in your population information, and then maybe look at a geographic identifier as well. You could pop in there. And it's found us 15 results there based on that. So the more specific you can be, the better. And then to access a resource, you can just click on the title. It'll give you all of this information about the resource. And usually the full text links will be up here if you can click right through. If you can't, then you can just copy this information and email it to us and we'll get you the full text. So again, when you're searching PubMed, you're searching those journals that have been indexed in the database. So if we were to move to, say, Google Scholar, which is the next place that I would start searching, you search for information. If we plug that exact same search in that we just did in PubMed with all of the specific medical terminology in there, we're going to get 2,660, which is a lot more than what we had in the last search. So with Google Scholar, you have some limiters on the left-hand side. So you can limit by date right here. You also have some advanced search options as well. So you can go to advanced search And I don't know why it's been doing funny things here, but we'll just clean this up. Okay, so you have your keywords all plugged in. Then you can also choose to just have it search the title of an article. This is kind of dependent on whether how the metadata, like the title and the abstract, has been identified. So sometimes it doesn't always work, but you can try. You can also choose a specific publication or an author if you want, but we'll leave it broad for now. So we've narrowed down to 22 results. And again, it's Google Scholar is indexing journal articles. It's just pulling from a lot more than PubMed indexes. But you can see the Canada Communicable Disease Report. You can see Lancet, MC. So there's lots of information that it's, lots of publications that it's pulling from. Again, playing with those keywords, playing with those different concepts from your word map, looking at what your particular population and interest is, and really using those keywords to control how you're searching. Okay, so then if you want to broaden out a little bit, you can also try pulling in some of those other concepts like traditional knowledge in, and again, looking at your population keywords and how you're using those to help search for information as well. And then you can narrow down using the different limiters as well. And the different keywords that you choose are going to be giving you different results. So again, choosing those keywords really carefully. It takes a lot of time to find Indigenous health information. I would say and it is a lot of back and forth, plugging in different terms, searching, trying new and different things, more so than maybe some other areas. So if you are spending a lot of time, I would really recommend sending us a lit search request, and then we can do some of that searching for you if it's taking way too much time for you to find things.
And Gail, maybe I'll just share that when you and I were putting the session together, and you, so Gail also not only is a MyNet librarian, but also is the librarian for Kivalliq. We also are their librarian as well. So she searches a lot for, a big part of your job is searching for Indigenous health information. And yeah. I was surprised when you shared that so much of what you find, you're able to find through PubMed, which is like the #1 database to find health information. And so we also have our regular session on how to search for PubMed and some tips and tricks there. That's there's a recording of that on our MyNet website. And so it would just be taking some of those terms that Gail mentioned and adding them with those same strategies for how PubMed works. So you know, it's very unique and very specialized information that, like Gail has introduced us, needs to be treated much more carefully and delicately and with a different level of respect, I think, than other health information. But where to find it is still in, a lot of it is in the regular places, which I think is some really great news.
Yeah. And then I was going to move to regular Google now, because so Google Scholar indexes those journal articles as well, but then how you're going to get to some of that gray literature and some of those publications that are being produced by organizations and associations, you're going to find that with a Google search. So I'll just go to Google and I'll just try that same search that I had done in PubMed and in Google Scholar as well, because it's going to pull up different things for us this time. So now it's searching websites, things that are on websites. So we're getting things like Government of Canada, links and National Institute for Health. We're getting things from the National Collaborating Center for Indigenous Health, and some more Indigenous organizations. So because we've put in some of this medical terminology, we're going to probably end up with more medical associations for this particular search. But if we were to go out to say something a little bit more broad in our keyword searches, and we were to search, it will bring up some different resources as well. So thinking about narrow terminology, thinking about broader terminology, and playing around with those keywords. With Google, you can also use their advanced search settings. So if you go to that little tool at the top, and then go to advanced search, it will give us some options. And I really like to use the file type to restrict by PDF, because we're going to get to reports that way. And so if we just click advanced search, now we're getting some different information as well. Assembly of First Nations, ITK, and you can see how the Indigenous organizations are kind of scattered through, and you do kind of have to hunt around, and you probably have to scroll a little bit more to find some of the resources that you're hoping to find. You can also search by a particular website as well, which I'll use quite a bit. So if we go back to that advanced search screen, we can pick out the particular website. So here's just the National Collaborating Center for Indigenous Health, and I'll just paste it here. One note, when you're searching by a site or domain, you want kind of like the smallest portion. So you're going to take everything off before, like the www, and anything at the end. So you want a .ca, a .com, anything after, you want that eliminate as well. It will give you an error message otherwise. We still have our PDF selected. You can choose to keep that or not. And now all of our results are PDFs from the National Collaborating Center for Indigenous Health. So again, you're word mapping, you're tracking different organizations. So if there is maybe an organization that you found that's been really great in the past, maybe you want to try searching a narrower keyword with one website and kind of target search that way. I found that really helpful in the past. Yeah. And then this other example that I have, again, looking at your language and including different nations in your search to try again, narrow down your results. But again, you can see it's really hard. It is really hard to find. It's really hard to do a demo and get it to work just perfectly and find a huge amount of content. You're going to get one and you're going to go, oh, yay, I found one thing. And it's going to feel like it took a lot of effort to find that one. But it is really hard to find information. So the last thing I wanted to talk about with Google is consumer health information. And again, consumer health information is really hard to find. And, you know, send us a lit search and I will see what I can find for you. One of the approaches that I we'll use will be looking at a particular language. If you can get a translation of a particular term, like say cancer in another language, then you can do a Google search with those terms, and that can kind of help you narrow things down a bit and have a good number of results. Can be helpful depending on the language, but again, you've got many languages, many dialects. There's so many terms that you can be using. So if we were just to do like cancer and then it'll pull up because there is so much research on cancer and it is such a huge area. It's probably one of the areas that I found the most consumer health information in. But again, right away, you can see quite a few Indigenous organizations that have some information that you could look at and evaluate and see if it's going to fit your needs. I'm going to go to page 3 because I know one organization, Cancer Care Manitoba, they have, you know, a resource and it's been translated into a number of different languages. So you might find certain organizations, again, have done a substantial amount of work creating some of those consumer health resources that you can use and pass on. Yeah, okay. So again, can be really challenging to find resources, and don't hesitate to send us your lit search requests if you aren't able to find what you need. So the last resource I was going to talk about is OpenPolar. So it's free to search. It has information relating to the circumpolar north. So if you're in northern Manitoba, it can be, you can find information within the database. About a third of the records, they have geolocation, so you can actually search by map. They have a search tips page that it can be helpful to with somehow to search ideas. So again, you can type in, you can use pretty broad keywords in this database and it'll pull up Indigenous information fairly quickly. We can limit by, you can limit by date, and you can limit by geographic location. So we can say Canada and, you know, quite a few things coming up. You can also search by map, which is kind of neat. So you can click into the map, find Manitoba, and kind of draw an area. And it takes a minute for it to retrieve the data. But you're not searching everything. So it's just going to be pulling out things that have been assigned a geolocation on them. But then it has a number of different, then you have a number of articles that you can pull from and you can limit from too. But so that one is freely available to search as well. So I will pass it off to Orvi for evaluating information.
Okay, thanks so much, Gail. And I'd love to hear those in, if you, everybody wants to chat, if there's something that you took away that you're going to, it's going to give you a bit of confidence, or if you're like, aha, I'm going to go and check this out. We would certainly love to hear those. So if you want to pop those in the chat while I just will finish out the session here. So what I'm going to talk about is what we call critical appraisal. And that's really about, okay, I'm just going to make that there. That's looking okay now? Yes, okay. So critical appraisal. So this is the stage where you've been doing your searching and you found what looks to you some really great Indigenous health information, whether it's by Indigenous people or it's about Indigenous people or whatever it might be. We want to then take a critical look at what it is and try to just assess whether it's appropriate to be using and whether it's the kinds or type of information that's needed for whatever it is we're doing. So this link here, the Critical Indigenous Research Toolkit, a reminder, we will be sending you these slides, so then you'll have the links. It's a checklist to help you look at research. So if you found a research paper in PubMed or through Google Scholar, these are some really easy to follow steps to do a little assessment about it. So has this research been validated by the community? Do the researchers acknowledge the participation and contribution of the community? It's a series of questions like this. And once you go through, if there are some yeses and some nos, or a whole lot of no's, depending on what you're doing and what you're going to be using that information for, then you can assess whether this is going to be a good resource for you to be looking at. The other, again, for those of you who have been to our sessions before, you know I really like the CRAP test as a critical appraisal tool. And it's because it's really quick and easy. And on a Friday afternoon, that's what we need to end our session. So the CRAP test is really about, is an acronym. The C stands for currency. So how recent is this information? When was it published? Is that current enough for you? At the start of the COVID-19 pandemic, we needed information about COVID that was within the hours old, whereas now we can handle COVID information that's maybe a few months old, and other kinds of information might be okay that it is years old or even decades old. So really, what are you doing? What is going to be current for you in the kind of information that you're looking for and the work that you're doing? Next is R. This is reliability. And with Indigenous health information, this is particularly an important one. And this is when some of the questions from the checklist I just showed you, some of those will help you know whether it's reliable, particularly community involvement and community recognition. So if it's a bunch of settlers who are writing it with no input from the community, and it's going to give you recommendations about how to, as practitioners, be providing health to Indigenous populations, I'm going to say absolutely that is not reliable. And also when you're looking at reliability, you're looking at other sources of evidence. Is this one person's opinion? Even if they are one Indigenous person, that would be important, but depending on what you're doing, you might need more than just one person's opinion. Also looking at commonly with health information, we're looking for if it's peer reviewed, if it's academic research. And again, a bunch of Indigenous health information is peer reviewed and some of it's not. And you might just need to say, is this the kind of information it's okay that hasn't been peer reviewed by an academic peer panel? If it's had a ton of community involvement and community input, maybe that is going to be sufficient. So, but just so long as when you're looking at it, you're thinking, is it current enough for me? Is it reliable based on what I need it for? And authority, certainly, who is it written by? And as Gail mentioned, particularly with Indigenous health information, we need to ensure that there is nothing about Indigenous people without them included in it. So again, are Indigenous authors involved, or were the authors involved with, did they have consent from Indigenous people to be using information about them or gathering information about them, or just making sure that those authors, not only are they authoritative on that topic, but they've been given permission to be authors in that particular way. And also who published it. That's an important element as well. And finally, the purpose or the point of view. What the information that you found, are they trying to sell you something? Are they trying to promote something for specific reasons? Or is it purely, and are they being honorable in how they're, is it trying to be propaganda? Or is there some kind of bias involved in it? So just taking that into consideration. And sometimes you might find something that's incredibly biased, and that might not mean that you shouldn't or can't use it, but you certainly might want to look for an opposing viewpoint to help balance that information. And finally, is the information at the right level for your needs? We know that often great places to provide introductions to Indigenous information, health, or more generally, there's some really amazing children's resources and and children's books. So that might be a great starting point. You also might be looking for resources to provide to children to help learn about medicine wheels or Indigenous ways of approaching health and wellness. So you might be totally appropriate to use children's books, and it might be totally inappropriate, and you might need only to be using published academic literature or PhD dissertations or what it might need. So all, again, who is your audience going to be? What are you using this information for? And is this going to meet your needs? And always, have you looked at a variety of sources and perspectives, or have you been pigeonholed only in looking in one way? And again, with Indigenous health information, are you seeing it from, most importantly, what are Indigenous communities saying on this subject? Is ensuring that you have that. Commonly, we say, sometimes an easy tell is, are there spelling, grammar, or typographical errors? Sometimes in instances where English is a second language, or just, or maybe Indigenous people are using language or using English in a certain kind of way that that's intentional on their part, but might seem a little different to us. This is just, sometimes it's a tell that the information might not be for you. And other times you might just say, that's just the way it is. It's still a really important source for me, and I'm going to continue using it. So CRAP test, currency, reliability, author, purpose and point of view, thinking about the right level of information, and then you can go forward and decide if that's going to be a great source for you. We have gone over time. We are 3 minutes over, so we'll finish it up. These are some links to some additional helpful information, and we'll share these with you. We are available for questions, even though we're at the end of time. We really appreciate you being here with us today. Gail, any closing thoughts or comments on your part?
No, just that there's so much information to share and talk about in terms of Indigenous health information. And if you have any questions or want us to do a search and find resources for you, just let us know. We're more than happy to support and help.
Okay, amazing. Well, we'll stay on for another minute or so if anybody has questions, and by all means, you've got our contact information, and we are happy to answer those questions either today or, and we've already got in the chat that we will be hearing from someone. You will be hearing from me, and but in the positive way, meaning that she's got some questions and she's going to need some help finding some information. All right. Well, thanks so much, everyone.